Thank you very much for staying for 2 days until this time when we are going to probably present the Kigali statement, which I think is really a document which reflects all the discussions, the reflections, but also our commitments as we continue to work together collaboratively to build this, to advance this public health and also building resilience and sustainability. So again, first of all, I think Rwanda Biomedical Center is really great. It's really we are really happy and standing here to express our gratitude. I hope that you enjoyed the 2 days, apart from the sessions. Thanks to all the speakers. Great discussion, great topics. Thank also to all the participants who have been here with us physically, but also who have joined us remotely. So again, thank you very much. We hope that we have really made your stay enjoyable, but also memorable. And we also hope to see you very soon. So without taking much of our time, I'd like to invite Neil to really, again, briefly giving you some of the current version of the Kigali statement, which I say, let's move this meeting by concrete actions and really continue to really take those commitments as our day-to-day achievement. Thank you. So over to you, Dean.
So thank you very much, and thank you to everybody for the rich comments that came in on the statement. So quickly, just to recap on the process, you'll all be aware that in your programs there was some clear objectives and background in the program documentation. So we were able, using that background and those objectives, to produce a first draft, which we sort of shared in outline yesterday. So since then, we have been listening to the discussions and trying to strengthen the statement based upon the rich discussion that's happened in the room. And there have been various changes. So we've reflected the very important statements on the importance of primary health care. We've recognized the sort of broader determinants of health and the structural inequalities that exist. The language has been kept quite loose and generic, and the process for finalization will be that this document goes to the executive board for sign-off. And as a membership organization, we rest authority in the executive board, and they will go through the document in full. So rather than making this into a final drafting session to craft it, it's easier to do it in that way. We had a number of suggestions about things people would like to see in the document, which we've tried to incorporate. But just as a statement of principle, I mean, IANPHI is a membership organization. So we can provide guidance and we can provide tools, but we at no point tell national public health institutions what they should do. So we can commit IANPHI to providing support, we can commit IANPHI to working in partnership, but at no point will we be directive to you, because you manage your own countries, your own public health situations, and it's not our role. We're there to support and back the decisions that you make. So we've also tried to avoid any language that suggests that we're instructing anybody to do anything, but we're making a collective commitment based upon a set of principles. So I think we have just a broad overview of the statements. It will be badged certainly as an IANPHI, but recognizing the fantastic hosting of the Rwanda Biomedical Center. The logo of the Rwanda Biomedical Center will very definitely be there at the beginning. And then the first paragraphs on the next area just recognize that where we are, that inequity, climate and environmental change, the objectives of the meeting that were stated in the program are those that are reflected at the top. We've discussed this decision point, and we've had lots of discussions on the learning post-COVID. and we had the very clear presentation on the essential public health functions, and we are committed to supporting national public health institutions develop their capabilities to ensure countries deliver the essential public health functions. So this recognises that NPHIs don't necessarily deliver all of them. They're often the responsibilities of a range of agencies at a country level, and so we need to work with countries and national public health institutions where they exist. So again, we don't step beyond the boundaries to suggest that all NPHIs should deliver all of the EPHFs, but it's a broad commitment that we're trying to ensure is reflected here. We've reflected Dr. Sabine's sort of comments, which were incredibly helpful, highlighting the united purpose that we bring by working collectively. Again, we've noted the hosting by the Rwanda Biomedical Centre. We also, given that this meeting is hosted on the continent of Africa, wanted to pay particular compliments to the strong leadership that has been shown in Africa to support the development of national public health institutions and the delivery of the essential public health functions. So that is very much embedded in the document. We then move on to talk about the role of NPHIs in emergency preparedness and response and their leadership role in supporting integrated health systems and strengthened surveillance. Again, bringing that back to the EPHF functions, but also recognising that whilst many of us discussions have focused on communicable disease and emergency preparedness and response, we've had rich discussions on the broader determinants of health, on the actions that NPHIs can take to address non-communicable diseases and to address structural and environmental determinants of health. So that's been broadened. Again, we recognise this important partnership between WHO and IANPHI, presented in Dr. Tedros' statement delivered by Dr. Bryan, and then we go on to a set of commitments that we make. And again, these are broad collective commitments that we're making, so we're not obliging anybody to do anything, but they're a set of principles, really, that IANPHI as an organisation commits to supporting its membership to deliver. Recognising that NPHIs are a vital resource for building resilience and sustainable health systems. That's an important advocacy message for countries which don't yet have national public health institutions, and hopefully it's a message that reinforces the position of national public health institutions in those countries which do. We reflect the debate that was had on technology, artificial intelligence, but also the important discussion which was certainly picked up by Dr. Taj in that last session on the challenges around inequity that occur when technologies are developed and yet not equitably accessible to all countries in the world. So we think the equity issue is particularly important in relation to that agenda. So again, we're highlighting that we want to support all countries to deliver the full range of essential public health functions. One of the other documents that we've mentioned is the roadmap for public health, and we heard some very strong advocacy from Dr. Kasum in particular about the importance of the public health workforce. We didn't want to repeat things that are already in a joint commitment between IANPHI and WHO, which is to deliver the roadmap on the public health and emergency workforce. So we've specifically referenced that that roadmap was jointly developed by IANPHI, WHO, and a range of other partners. So again, that has been included, which wasn't there before. We then go on to recognise specifically, because we had only talked about national public health institutions, and we're hugely supported by the regional networks, and there's specific reference to the contribution that the regional networks bring to the IANPHI sort of organisation. So that is brought in. We then had a very valuable discussion on, and particularly picked up in this last session, on the role of communities and their vulnerability, which is their increased vulnerability due to things like sort of climate and environmental change. And so that commitment to work with and support communities, but bringing in the idea of well-being in addition to health. And again, that was a suggestion that came from WHO, reflecting the broader need to not only address health, but also well-being in its broadest sense. And then we've had discussions which I think were reflected particularly in the CARFA comment on the pandemic fund, and also in some of the statements from Africa CDC and from the Berlin hub from Sarah and Scott on the new architectures that are being created. So it's a commitment to work with them in order to ensure that we can make the maximum use of the resources that those bring to our collective efforts. And we come back to saying that we make these statements because many IANPHI member countries have suffered from the impact of climate and environmental change, and we heard very compelling stories from Pakistan, for example, about some of the devastating inundations that they have had to confront, but that is true in many countries of the world. So this is an agenda that we need to take forward urgently to address challenges that all countries face, and it's the role of IANPHI to enable the collaboration between member states in order to sort of share experience and lessons and generate evidence that can inform our collective practice. We also wanted to make reference back to the Stockholm Statement, because we've not discussed it in this meeting, but conflict and war and instability, which were discussed in great detail in Stockholm, are also important, and therefore reaffirming our commitment to the statements made in Stockholm were important. So hopefully, if people are content with that suggested process, then we will leave it in the hands of the executive board to review the final documentation and make any final suggestions. But my hope is that we've broadly captured the spirit of the discussions, we've reflected the objectives that were set out in the documentation, and we hope that this is something that we all feel reflects the discussions, the very rich discussions that we've had over these last 2 days. So with that, rather than going into detailed comments now, I think the easiest process is to sort of leave this with the executive board. So I'm going to hand back to you, Dr. Claude, and see whether there's anything else or any immediate reactions, or Duncan. I'll let Duncan and Claude, if you both come together and sort of handle any further comments.
Thank you, and thank you, Neil. That's beautifully articulated. So I think we can share this, Prof. Cod. We can get the draft out so everyone can see it. Any final or thoughts that you have to share, but otherwise we'll take it through the executive board, who are made up of some of you in this room, some who aren't, and then we can publish it once that is finally endorsed. Prof. Cod, do you think way forward? Yes.
I think there's one or two in the draft that this important IANPHI conference for 2024 or 2023-24 was held in Kigali, hosted by Rwanda Biomedical Center, but also the Ministry of Health and the government of the Republic of Rwanda. It's just not the Rwanda Biomedical Center. Am I correct, Professor? Yeah. So that is very important, because the ownership of Rwanda, which is a member state of the World Health Organization, is very critical. And then I also want to request one small thing in the culture of IANPHI, is that IANPHI board and institute takes this at the global level, but this implementation of this important Kigali Declaration is also owned and managed and led by the government of the Republic of Rwanda till it hands over to the next member state, which will then, so that you have an institutional power of a member state to help IANPHI and IANPHI in negotiating the implementation and really making it happen. Thank you.
Thank you very much for these comments and reflections. I think the presence of the Minister of Health, first of all, is one of the signs and evidence that the government of Rwanda is endorsing this Kigali statement and also the meetings. So we'll see how to have the Minister of Health representing the government of Rwanda, because we might not probably include the government of Rwanda without further consultation, but the Minister of Health is enough where we can probably add it. And Rwanda Biomedical Center, as the main implementing agency of the Minister of Health, would be also aligned with the Minister of Health. So this could be enough for that, yeah. So we'll probably include this in the final draft, yeah. Thank you.
I agree with Claude. So can we just take assent in the room that this is how we move forward? Thank you, everyone. Thank you, Claude, thank you. And Catherine. Sophia. Hi, Sophia. Would you like?
Obrigada. Now you start getting used to Portuguese. So, we have prepared something special. But before that, maybe I can say some words about our history with IANPHI. When I started working at INS in 2007, I could already hear about IANPHI, how important it is to be part of this association. And you can imagine who was always talking about this. It was Dr. Yilesh, that you know very well. He was the previous, most of you know, he was the previous Director General at INS, and he's now the Vice Minister of Health. So then I find out that we start being members of IANPHI in 2006. So we are members since 2006. And Dr. Yilesh, he was from the executive board for 2 mandates since 2013. And today, it was just presented that Eduardo Samagudo, the present DG, is also a member of IANPHI. So this shows how engaged we are with this association. I will also share some of the engagement that we have with IANPHI in the past. So IANPHI played an important role in the transformation of INS Mozambique, structuring our vision, helping to define our mission, writing our first strategic plan. You also work with us writing, structuring the new building. You will see how it is now, the new building of INS, and also advocating for funds to build that infrastructure. IANPHI also supported us interacting with other public health institutes. This interaction was essential for continuous learning in scientific and in management areas. So there are no doubts that IANPHI is one of the most important strategic partners for INS and participates in our continuous transformation into a broader public health institute to respond to the needs of the Mozambicans. So this was just a few words about a summary of our collaboration with the IANPHI and the importance that IANPHI has to INS. And these are just a few reasons for how it is so important for us to host the 2025 IANPHI meeting. So this is all for now. I really welcome you all to Mozambique, to Maputo. We are looking forward. After the dinner yesterday, I felt I was really traumatized, like, okay, I have a huge responsibility now. But we will do our best to receive you the same way that the Rwanda colleagues have received us. But for now, we have prepared a short video to welcome you to Mozambique, and with a short message from Eduardo Samagudo, our General Director. The video is in Portuguese, so you get used. I'm kidding. No, it's in Portuguese, but there are titles there.
Moçambique, país independente desde 1975, está localizado na costa sul oriental de África, com um extenso litoral que abriga um variado mosaico de ambientes e ecossistemas para conhecer e explorar. Esta geografia proporciona ao país um potencial turístico, destacando-se os recursos litorais e marinhos, florestais e faunísticos, sem colocar de lado a diversidade cultural e gastronómica. Moçambique é um país em desenvolvimento com população maioritariamente jovem. A esperança média de vida é de 56 anos de idade. O país tem estado engajado em iniciativas visando materializar a cobertura sanitária universal através da expansão da rede sanitária a vários níveis. O Instituto Nacional de Saúde de Moçambique é a entidade pública responsável pela gestão, regulamentação e fiscalização das atividades relacionadas com a geração de evidência científica em saúde para a garantia de uma melhor saúde e bem-estar da população moçambicana. São competências-chave do Instituto Nacional de Saúde a realização de investigação em saúde, vigilância epidemiológica, implementação de serviços laboratoriais de saúde pública e a comunicação e formação em saúde. Para a materialização da sua missão e atribuições, como Instituto de Saúde Pública, conta com o apoio de parceiros locais, regionais e internacionais, entre os quais gostaríamos de destacar a IANPHI. Moçambique foi eleito para acolher a próxima reunião da IANPHI em 2025. A reunião terá lugar na cidade de Maputo, conhecida como Cidade das Acácias, devido à predominância desta árvore ao longo das avenidas e ruas. Com um clima tropical, Maputo dispõe de uma variedade de hotéis de 5 estrelas e serviços de restauração, museus e centros culturais, praias e reservas naturais. O maior aeroporto de Moçambique localiza-se na cidade de Maputo, que recebe diariamente voos intercontinentais. A distância do aeroporto para o centro da cidade, onde se localizam as principais instâncias hoteleiras e centros de conferências, é de cerca de 15 minutos.
É para nós uma grande honra acolher a reunião anual da IANPHI em Moçambique. A realização desta importante reunião representa uma oportunidade singular para a partilha de experiência de Moçambique na construção e consolidação do Instituto Nacional de Saúde e do seu papel no fortalecimento do Sistema Nacional de Saúde. Gostaria de aproveitar a oportunidade para convidar a todos a juntarem-se a Moçambique na reunião anual da IANPHI 2025 em Maputo.
Thank you so much. Muito obrigada. And you are all very welcome to Mozambique next year. Thank you.
Well done, Sophia. Where's Claude? So you've traumatized. I definitely came within an inch of being speared last night. You promised us a year ago that we'd have a great experience, and you have delivered on that. Congratulations, and thank you. The whole arrangement has been superbly delivered, and all the people that have taken to making this event and all the logistics, the people who have been managing the sound and those that have been looking after us within the hotel and the catering, is to convey our thank you to them. Without them, of course, all else becomes less possible. So we need to say thank you through you, Prof. Claude, for conveying that to all those involved, if you would do that. I have, this is only going to take half an hour. Actually, Neil gave a very great summary, and the follow through, because the Kigali statement does cover very nicely what we've discussed. But I did want to just make sure I didn't miss anyone. Well, all my paperwork is gone. Okay, I shall improvise. And actually, Prof. Claude, you did say thank you to all those that moderated and spoke and contributed here and internationally, and all the folks that have been here and have asked questions and got engaged. So if I can say thank you to them as well. There is so much for us to be proud of in the work that we do. There is a very important message about how we recognize contextually the differences between us, as well as what holds us together, and the common purpose that we have, which is to protect and improve the health and well-being of our people. And we do that by working together. And we had, I think it might have been Stephen who talked about infectious diseases hold conferences, about how they can inflict pain and misery and economic harm, and somehow we need to keep going in learning and sharing, working together, recognizing that we are stronger together. Taj, where's Taj in the room? Taj, I was with Jon Kengasong and yourself some years ago where you gave me that quote, the African proverb, which has already been quoted today, but I think it works beautifully for IANPHI, which says, if you want to travel fast, go on your own. If you want to travel far, travel together. Thank you. Thank you for everything. Let's close now. And I think we have drinks outside. Thank you, everyone. Thank you.